In this video, I'll be covering a lot of information regarding PCOS and PCOD, also known as polycystic ovarian syndrome or disease. To clear the confusion, both PCOS and PCOD is one and the same thing. To give you an overview, I'll be covering what is polycystic ovarian syndrome, commonly asked FAQs, a treatment plan which I adopt at my clinic along with few homeopathic medicines which has given me results with my patient. Towards the end of the video, I'll be recommending a natural therapy which in combination with my other suggestions will help beat PCOD. So let's get to it. What is PCOD? A normal female body secretes the following hormones: estrogen, progesterone, luteinizing hormone, follicle stimulating hormone, and small quantities of male hormone called testosterone. These hormones are responsible for regularization of the menstrual cycle, also known as menses. The menstrual cycle is divided into three phases. The first phase is called as the follicular phase. During this period, the follicles or the eggs are developed in the ovary. Second phase is called as the ovulatory phase. During this period, the mature follicles or the eggs are released from the ovaries. The third phase is called as the luteal phase. During this period, the endometrium is developed for the process of implantation. If I explain this in simpler terms, a bed is developed for the process so that the baby can develop if and when conception happens. But due to PCOD, the follicles tend to remain in the ovary itself and are not released, leading to absence of menses. This causes your ovaries to release excess amount of male hormone called testosterone, which causes you to develop acne and excessive hair growth, particularly on your face. Due to increasing levels of testosterone in your blood, it leads to insulin resistance, which in turn causes your pancreas to release excessive amount of insulin. This entire process causes you to gain weight. Hence, it becomes a vicious cycle because PCOD causes you to gain weight, and gaining weight only further worsens symptoms of PCOD. Here are the commonly asked FAQs. My sonography report shows multiple follicles in my ovary. That is, PCOD-like appearance. Do I have PCOD? No, unless you have other symptoms like excessive weight gain, irregular menses, and acne. A single sonography report is not sufficient enough data to diagnose you as PCOD. Is PCOD completely curable? Of course. Like any other lifestyle disorder, once you get to the root of the problem and make appropriate changes in your diet and lifestyle, you can get rid of PCOD completely. Can I conceive if I have PCOD? PCOD causes irregular menses. Hence, it becomes difficult to conceive. But instead of thinking what PCOD can do, rather work on getting rid of it with the help of medication and appropriate changes. Once you do that, I do not see a problem in you conceiving. I have been previously treated for PCOD. Can I get it back again? Unfortunately, yes. You need to understand that PCOD is a lifestyle disorder. If you suddenly gain weight or lead an unhealthy lifestyle, it will be back. The changes that you made during the process of treatment make it a way of life. This will also help in preventing other lifestyle disorders like diabetes and blood pressure. These are the commonly asked questions by my patients at my clinic. If you have any other queries, do leave a comment below. I follow the triangle method at my clinic in order to manage PCOD. One end of the triangle is medication, which I'll be mentioning shortly. The other end of the triangle is diet. In order to simplify the diet, let's divide it into two food groups. First, foods which affect PCOD directly. Gluten-rich foods, foods made with refined flour, bakery products like bread, biscuits, cakes should be avoided. Foods which are rich in sugar should also be avoided. Milk. Yes, animals are injected with certain kind of hormones in order to increase the production of milk. This milk, when consumed, directly affects your PCOD. Second, foods which cause you to gain weight, which in turn increases your PCOD. Calorie-rich dense foods. Foods which are rich in cream, butter, oil. Deep fried foods should be consumed in moderation. Last or final end of the triangle is exercise. Obviously, exercising will help, but what I mean is being active and not being a couch potato. Taking the stairs instead of the lift. Walking up to your destination instead of taking the transport. Being active should be a way of life rather than a compulsion on your body. Here are my top homeopathic recommendations for PCOD. First, Aristolochia clematis 30 can be taken when there is a history of OC pill consumption or excessive hormonal tablet consumption without any relief. Also, you develop acne prior to getting your menses. Doses for the same would be twice a day till you experience relief in your symptoms. Second, testosterone 30 can be taken when you have developed excessive facial hair because of PCOD. Doses for the same would be twice a day till you experience relief in your symptoms. Third, Damiana Q or mother tincture is indicated when there is amenorrhea or absence of menses along with PCOD. Doses for the same would be 10 drops in half a glass of water, that is 150 ml water, thrice a day for a period of 15 days. One alternate natural measure which I use along with main medicine to help PCOS and PCOD is seed cycling. Seed cycling is a simple yet effective intervention which involves consuming seeds at particular times in the month. A normal female cycle lasts for 28 days plus or minus 2 days. Accordingly, this cycle is divided into two parts. The first part or the first phase begins on the first day you get your periods. It is also called as the follicular phase because during this period your ovary tends to release follicles or eggs. What you need to do is consume 1 tablespoon each of flax seeds and pumpkin seeds every day for the next 14 days. These seeds are rich in phytoestrogens which help maintain estrogen which is required during this period. Next comes the second phase which begins on the 15th day from the day your periods have begun. It is also called as the luteal phase. During this period, your endometrium, which is the inner lining of the uterus, begins to grow. The endometrium is also responsible for growth of the baby if and when you conceive. These seeds are rich in lignins called as enterodiols which help maintain progesterone, which is the need of the hour. I usually recommend my patients to continue this cycle for 6 months as this gives good results. Along with the benefits that I mentioned above, these seeds are also rich in omega-3, zinc, magnesium and iron, all of which help support fertility. You need to understand that seed cycling is only an adjunct to main therapy, along with changes in lifestyle and diet. No single therapy helps. If your periods are irregular and you are wondering when to consume these seeds, do get in touch with us. I, Dr. Mohsin Thanawala, will be glad to help.